Hi there, welcome. Please get comfortable. I'm Dr. Tinglestorm, but you can call me Stormy. And I know that you're very lucky to be here today because you're gonna undergo some very thorough examinations. Are you ready? Absolutely no need to be nervous. You're in great hands. Why don't we start with something easy, okay? Something where you don't need to do anything, so I can put you at ease in the meantime, okay? Would it be okay if I checked your ears and then do some hearing tests? Absolutely. I'm gonna be super gentle using my otoscope and coming close to your ears if I have your permission. Wonderful, so I am coming closer. Okay, I'm just having a look at your ears and the ear canal right now. How is that feeling? Okay, I'm just palpating a little bit, working my way a little more in depth, a little more in depth. Also, I hope you don't mind if it's very stormy outside. You're absolutely safe here, so if you feel like some rain or wind, always remember that it's outside and I am here with you, and I will protect you and make sure that you're safe and fine, okay? Alright, so I do see a little perhaps ear wax build up an irritation in this ear right here, so I'm going to have a look at the other ear now and see what we have to work with. Okay, let me see, just right here. Yeah, okay. How is it feeling? Do you feel any pain or discomfort as I work my way a little bit more in depth into your ear canal to better see the state of your ears, the eardrum, and all the little components? Okay. Same thing here. I do see a little bit of perhaps wax built up an irritation, and I don't know, do you feel any particular discomfort in this moment? Okay, I'm just going back to the other ear to make a more detailed comparison of what I see. Okay, yep, I do see something that is concerning me a little bit. Not bad, nothing bad. I'm sure it's nothing bad, but I wanna do a couple hearing tests for sure. Let me come back here. Yeah, I definitely want to do a couple hearing tests and see what we have to work with, okay? But please do not worry at all. Everything is gonna be okay. I promise you're in great hands. Alright. Okay, so from what I could see, there is a little bit of discrepancy in your ears and a little bit of irritation, okay? So, can you please tell me, if I touch your ears like this, do you perceive any sensation? Okay. going to very gently bend your cartilage around the ears, okay? And I am asking you to tell me if you feel any particular sensation as I do so. Is that okay for you? Okay, I'm gonna be extremely gentle so you don't have to worry about anything, okay? I am coming closer and just squeezing and gently folding your ear. How does it feel? It's a little bit stiff. Okay, I see. That can be related to what I found in your ear canal in terms of, a little bit of irritation. Let me just do the same thing on the other ear, okay? I'm just here, gently folding and gently squeezing. It's a little more tight on this side. Can you agree with me, maybe? Yeah. Okay. Now I would also like to compare both of your ears to really make sure that my sensations are correct. And of course, please do tell me if you agree, disagree, or anything that you want to point out about it. Okay. Yeah. We can definitely agree with that then. Okay, cool. I want to make sure that you do perceive my hands touching you, okay? So just touching your ears. Do you perceive it? Okay. Good. Okay, I am now just going to isolate the ear. So I'm just touching one of those. And of course, I would like you to tell me if you feel it, okay? I'm now touching your right ear. Do you perceive that? Okay. And I am now touching your left ear. Do you perceive that? Are you sure? Let's try that again, okay? Okay. And here. Okay, it's very curious. So basically your sensation is flipped. Okay. Let me just try to tap on your ears, okay? You should feel a very distinct tapping sound. Okay? Let me see. Do you perceive that? Okay. towards the surface of your ears, up, down, further and backwards. Okay, let's then try to isolate again. And from this side. And the same problem, of course. Okay, curious. Now just some tuning fork. Do you hear it? Do you have any trouble hearing it? Okay. And if I ask you to look at my finger, can you still tell me if you hear it to the left or to the right? I'm gonna try to whisper some words into your ears, and you can actually repeat them for me, so we can see how you elaborate the sounds. Okay? I said banana. Caterpillar. No, it was skateboard. Let's try here. I'm gonna say a couple more words, okay? No, it was window, blind, and fold. Well, I'm so glad you didn't really hear that because of my lack of originality, I guess. Let's try again here. No, it was carpet, fork, and blanket. Let's try with numbers. Okay, I don't want to alarm you, but none of them was right. Okay, I am going to definitely address you to an ear specialist after the exam to make sure everything is fine with your ears, okay? As I said, it can just be a little bit of irritation or wax buildup, but we better make sure about it, okay? Let me just do a couple olfactory tests for you now. So I'm gonna place this close to your nose. It is infused with essential oils, so it's gonna be pretty easy for you to recognize it, okay? So smell it. What is this? Yeah, I know it looks like a cookie, but the goal of this test is to actually have you really relying on your nose. So if you can try again, because it's not really cookie. Let me try to squeeze it. Maybe I can maybe diffuse the smell of it a little more. So no, it's actually sandalwood. I know it's not like the most easiest detectable thing, but it's totally opposite from cookie, so at least I hoped you could be confused. let's try again. Okay, so you know it doesn't smell like cake, but it doesn't smell like mint either. Well, this was actually one of the easiest because it actually smelled like chocolate. And it's very clear, so I am a little bit concerned about this. Let's try again with this one, okay? Let me just really make sure I liberate the essence so that you can detect it more easily, perhaps. So, what is this? No, it's not lemon. It's actually onion. I know. There is onion essential oil, and I have it for my tests. So, yeah, you couldn't recognize something as onion. Like, I could accept armpit as a possible match, but definitely not that one. Let's try again, okay? Just liberating the essence. Okay, you can't go wrong with this one. What is this? No, it's not gasoline. Okay, try again, please. Try again and really focus, okay? Sniff deeply with your nose. No, it's not fish. It's coconut. It's coconut, yes. Okay, so I think we also need your nose to be checked, okay? Definitely, we do. Let's just take a break and do something for the eyes, maybe. So I'm asking you to read here, okay? I'm going to illuminate from behind. So, can you read this letter? Here, this letter right here. Good. Can you read this? Yes. Can you read this? Okay. How about this? Cool. Okay, good. And how about this? Okay. How about this? That's a little bit hard. Can you maybe try to read this entire line? All of it? All of it? All of it? Good. That's nice. I have to compliment myself. So now I am using this instead, okay? I'm not using a light because I know it can be a little bit harsh on you. So I'm asking you to look here, then here, then here, then here, okay? I'm just going to wiggle my finger. And as I wiggle my finger, I need you to move your eyes towards these. Let me just make them a little bit wider so it's going to be a little bit easier for you, okay? Good. 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 Now a little bit slower. Good. Nice. Again here. And here. And here. And here. And here. And here. And here. I need you to look at this bedazzled handle right here, okay? And I need you to follow it with your eyes, okay? Just follow it. Okay, good. Follow it. You're doing very good. So are you having a hard time following it? Is the bedazzled effect creating you any discomfort on the eyes? Okay, great. Now instead, I am going to ask you to look at my nose as I allow this bedazzled handle to pass through, okay, through your eyes, through your visual field. But I need you to keep looking at my nose as I do so. Keep looking at my nose as I do so. Here. Nice. Okay, keep looking at my nose. 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 Good. Okay, so I need you to tell me if you perceived any difference in the brightness from one eye to the other as this was passing to your visual field. Okay, very good. That's fantastic. I now have to have a look at your throat. To do that, I'm going to use my tongue pusher, and this time I'll have to use a light, okay? So I need you to open your mouth real wide and say, okay. And now, can you say, for me, please? No, just, No, please just open your mouth real wide and say Okay. Can you say you can't. Okay. Can you swallow? Did you drink something sparkly, like sparkly water or glitter? Because I do see glitter down your throat. Okay, definitely think your throat as well needs to be checked. So I am just trying to brush your face now, okay? Brush. Can you feel my brush on the face? And where? Okay. Good, so the face sensitivity is there. I'm going to touch you with a hot and a cold one. They are exactly the same, but I need you to tell me if it's hot or cold. Hot or cold? Good. Hot or cold? Good. Hot or cold? Hot or cold? Good. Hot or cold? Hot or cold? Okay, so your cranial nerves are actually working fine, except for these little problems in your ears, nose, and throat, okay? So I am sure you're healthy and fine, but I want to make sure that you get checked by a professional. So I am addressing you to Dr. Maple to make a very thorough ear, nose, and throat examination. No, you don't have to move. Just stay here. She's coming right here. She has an expertise in this kind of conditions and problems, so she will reassure us for sure and make sure you're feeling amazing, okay? In the the meantime, thank you so much for your attention, and I am leaving you to Dr. Maple.
Hello, I'm Dr. Maple, and I'll be your ENT doctor today. I've just finished reading over your file that Dr. Tinglestorm sent over. It looks like she's been taking really good care of you, but we're just gonna take a little extra look since it seems like we're dealing with an excess of glitter. Yeah, it's a very common problem, more so than people would think. Okay, so first I'm just going to put on my gloves. There. Okay, I'm just going to start with a brief visual examination to see vaguely what I'm working with. So, do I have permission to touch you? Perfect, thank you. Let's take a look here. Yeah, I can already see a few signs of an excess of glitter, but nothing that would alarm me. Yeah, I think this is a reasonable amount of glitter. Let's take a look at your ears. Yeah. Sometimes this can happen through ingestion. Sometimes it's just an accident. Sometimes people are just too fabulous, and then there's just too much glitter, but anyway, we can deal with it. Okay, good. Yeah. Okay, I'm just gonna use a flashlight, so bright light warning. I'm just gonna look a little bit closer in your ears. Yeah. Okay. Yeah, I can see a few problems, but like I said, nothing very serious. Definitely something we can help you with. Let me check the other side. Yeah. Pretty similar over here, which is actually good that both sides are about the same. Okay, I'm just gonna go in next with my otoscope. So you might feel a little bit of pressure in your ear, but it's nothing that's gonna hurt you. It's not deep enough to hit your eardrum. It's completely safe. Okay? Yeah, perfect. Okay. Let's see what we've got here. Yeah. just gonna go around and do the exact same thing on the other side. Okay? Good. Okay, same on this side. Just gonna feel a very slight pressure. Okay, perfect. Yeah, it's looking pretty similar in here. That's a good sign. Yeah, again, there's a couple of things that could be better, but overall it's looking pretty good. Okay, same thing. I'm gonna be pulling your ear back and up, just very gently. Yeah, there we are. See, nice and gentle. Just gonna get a nice, good look to make sure that you are fit as a fiddle. And yeah, it's looking pretty good in here too. Okay, good. Okay, so now that I know all that I need to know about your ears, I'm gonna take a closer look at your throat and mouth and nose. Okay? So I'm gonna come back in with the flashlight. Yeah, there we go. Can you say "ah" for me? Yeah, I know it's a little difficult for you, but that's okay. You're trying your best. Yeah, if you need to close your eyes or blink or anything like that, that's okay. Whatever makes you the most comfortable. Okay. Yeah. I can definitely see some glitter here. It does look like it's a reasonable amount. Yeah. And everything around it looks very healthy. Okay, good. I'm just going to make sure that the glitter isn't affecting your breathing at all, because that's the only thing that would have me a bit concerned. So I'm just gonna take a little listen. There. And can you take a deep breath in and a deep breath out? Good. And deep breath in here. And a deep breath out. Good. And a deep breath in here. And a deep And a deep breath in. And a deep breath out. And one more deep breath in. And a deep breath out. Okay, good. Well, it sounds like everything is working okay with your breathing, so I'm not worried about that at all. I think you are just simply experiencing an excess of glitter. Yeah, completely normal, completely understandable. So I'm just going to write you a prescription for some anti-glitter pills. You'll have to take these twice a day for 2 weeks with some food. Maybe take them with a glass of water. Might make them more comfortable. And then everything should be a-okay in 2 weeks. Perfect. Thank you so much for coming in today on behalf of Dr. Tinglestorm and myself. I hope you're feeling lots better soon, but I'll be seeing you around. Bye.